A Margaret River mother says she waited more than 60 hours in 2 Perth emergency departments in an attempt to get psychiatric care for her 16-year-old daughter. With the state's health system struggling amid intense pressure, a mental health advocate is calling for alternatives to EDs for people in mental health distress.
16-year-old Indi has struggled with her mental health since she was 10 years old, when she was diagnosed with autism, ADHD and obsessive-compulsive disorder.
Sort of mid-high school, she just sort of fell into a depression, I suppose.
Simone says a couple of weeks ago, things reached a crisis point, her daughter telling her she didn't want to be here anymore.
She's had enough. It's too hard. She just feels like she's dead inside and just doesn't want to live.
Unable to get urgent help in Margaret River, they drove almost 300 kilometres to the emergency department at Joondalup Health Campus. Unable to stay inside the ED because of her fear of people vomiting, she sat on the concrete floor outside.
Asking a mental health person to wait is like asking a pregnant woman to hold on and not give birth. It can't wait. It absolutely can't wait.
After 9 hours, they went home.
She's just scared that we keep trying to get someone to help her and no one can help her.
A few days later, they went to Fiona Stanley Hospital, where Indi was put on a wait list for a youth mental health bed. They were there for 50 hours.
We just said, we can't stay here anymore. I can't do this to my daughter. It was just so cruel.
It's not an uncommon experience for many people in a health system that is meant to support them. They come out more traumatised.
Monique Williamson, who runs a community-based mental health service, says the system is overwhelmed and there needs to be alternatives.
Our belief is that people with mental health distress, ED isn't the place for them. It is too focused on many other things, and the environment itself isn't calming or conducive to recovery.
The Minister for Health has asked her department to reach out to that family to ensure that they get immediate access during this time of crisis.
The government says it's working to strengthen mental health supports and over the past 3 years has invested an extra $187 million into new initiatives to assist young people struggling with their mental health. Nadia Mitsopoulos, ABC News.
Simone and Indi's story is one of many which show the pressure Western Australia's health system is under. It's quickly becoming one of the government's biggest headaches and one of its most critical issues to solve, both for the health of Western Australians and in the longer term for its own political survival. With his analysis, here's state political reporter Kian Burke.
All the time we're being told about record investment in WA's health system. So why doesn't it seem to be making a difference? Let's start with some of the raw numbers, how much state money goes to WA Health each year. This chart shows government spending over the last 25 years, a 313% rise. Sounds pretty big, right? It is, but it doesn't account for WA's growing population. Factor that in and the spending per West Australian shows a 158% rise. But that's still not the full picture because, as we've all experienced in the last few years, inflation can have a real bite. Work that in, as you can see with this red line, and you end up with a 24% rise, about 1% a year. Still big, but not quite as big. And while in some ways advancing technology has made healthcare cheaper, it's also created new treatments, including for illnesses which might not have been treatable before, which all comes at a cost. The other big issue is this chart, which shows the growing number of West Australians aged over 65, rising from 11 to 16% over the last quarter of a century. Aged care is struggling to meet that demand, and often when they're unwell, these older West Australians are ending up in hospital. The end result is capacity in the healthcare system and in hospitals in particular being eroded over time. It means when there are spikes in demand like there was last week, reducing elective surgery is one of the few ways the system can cope. The Premier, Health Minister and Aged Care Minister are heading to Canberra this week to plead their case for more support from the feds.
On any measure, we are not getting our share, and we want the federal government to understand that that's putting pressure on seniors, their families and our hospital system.
There are no quick fixes for this problem, but it's clear both increased spending and major changes to the delivery of healthcare will be needed both now and in the years ahead.